Honorable speakers, esteemed guests, generals, and assistant professors Sadık Akyar from the university. We are in the second day of military medical web exhibition, and this is third webinar meeting. And thank you very much again, esteemed guests. So I would like to introduce our panelist speakers today. First, we will be together with Mr. Major General Mohammed Salman Ashraf. He's Deputy Surgeon General in Pakistan Army. Good afternoon again, General Ashraf. And Professor Major General Fasnur Rahman, Director General Medical Services in Bangladesh Army. Good afternoon again, sir, and welcome again our webinar. And Assistant Professor Mr. Sadık Akyar, Director of the International School of Diplomacy and Security Research Center in Krania, Girne American University in Northern Cyprus, Republic of Northern Cyprus.
Yeah.
So, welcome and thank you for your time. In this webinar, our title is Medical Forces Power. So the main purpose of the Medical Force Power session and this session is to discuss the presence and capabilities of the medical forces existing in the Ministries of Defense and the armies, which have increased the recovery capabilities of the armies both in the field of defense and the battlefield with a multiple effect. So, sir, in Pakistan Army, Professor Major General Mohammed Salman Ashraf, I would like to start with you. I think you have a presentation for us, and we are ready to listen to you and to watch you. So the floor is yours, sir.
Thank you very much. It's really an honor to be present on this august platform and to share my humble views and experiences with you, and to benefit from your immense and rich experience. Hope my presentation is visible to you.
Now, not yet, but I think we'll see, and we'll start if also our technical friends assist us. At the moment, we only see you, but your presentation hasn't started yet so far. If you try again. I think yes, it's yes. Yes, sir, I think it's starting now.
So can you see it now?
Yes, we see it now. Thank you.
Okay. Now let's start. Bismillahir-Rahmanir-Rahim. Respected Professor Dr. Major General Muhammad Fasnur Rahman, Director General Medical Services, Bangladesh Army. Respected Assistant Professor Dr. Muhammad Sadık Akyar, Director of International School of Diplomacy and Security Research Center, and all other respected and honorable participants. Assalamu alaikum. I feel privileged to have the opportunity of speaking on this august forum today from Pakistan. Pakistan, which means land of the pure, is unique, diverse, and beautiful, with K2 being the second highest mountain in the world, the largest canal-based irrigation system in the world, world's largest ambulance network, the largest deep sea port, highest paved international road called the Karakoram Highway, which is also called the eighth wonder of the world, and national anthem, the #1 ranked tune in the world, to say the least. We, the Army Medical Corps, being vital part of armed forces of Pakistan, are custodians of health and battle worthiness of men in uniform, along with provision of medical services to their families, with a secondary role in disaster relief and rehabilitation nationally and internationally. Our mission is to deal with all health-related matters in armed forces, including care, maintenance, rehabilitation, and promotion of health and prevention of disease. Medical assets. The Medical Corps has a number of hospitals having state-of-the-art medical facilities along with trained staff at par with world's leading healthcare centers. Armed Forces specialized units are single specialty centers of excellence. Worth mentioning here, as per the list being shown, images of few are flashed. Yep. I would take this opportunity to apprise you about how the Medical Corps has been actively engaged in inland and abroad relief operations and disasters. A look at some of the national and international level disasters in past few years is as shown. The 2005 earthquake was one of the worst in our country's history, which took a death toll of 73,338. Pakistan Army was the first to respond, and not only did we provide medical support, but furnished rehab services in the years to follow. Then, in 2008, Balochistan, our largest province, was struck with earthquakes, and in 2010, floods covered most areas of Punjab province, 1/5 of the country at that time being underwater. It was a mammoth task to cater for an area of 160,000 square kilometers where millions were affected. You may realize the human catastrophe and challenges faced during these calamities due to resource constraints and millions in need of help. These were some glimpses from the past. To mention a few international relief missions, the 2003 Iran earthquake and field hospital establishment in Indonesia after tsunami in 2004, and the earthquake in Central Java in 2006. Then the cyclone in Bangladesh and the earthquake in China in 2008 were amongst the first to arrive and establish field hospitals and to offer medical support. I would mention here that our field hospital is ready at a very short notice to be deployed inland and abroad. As far as contributions to international peace missions are concerned, Pakistan has been one of the major contributors to the United Nations medical missions in more than 7 countries. Ladies and gentlemen, COVID-19 pandemic is an unprecedented outbreak in our part of the world. To face the upcoming circumstances, we adopted a proactive, evidence-based approach from the very beginning. Participation by all stakeholders led to formulation of Armed Forces Action Plan, which was disseminated to all by mid-February 2020. What I believe is that resilience in military healthcare system can be achieved by encompassing aspects like good governance, effective utilization of medical technology, reappropriation of human resources available, modified delivery of healthcare services, adequate and efficient use of information technology, and timely management of finances. First case of COVID-19 was reported in Pakistan on 26 February 2020. We as a military force started preparing for COVID-19 outbreak once news of the pandemic started surfacing. Planning was carried out by taking into account every facet of healthcare delivery to include formulation of formation support plans, building up of efficient stocks of required medicines, along with availability of personal protective equipment to all our healthcare workers and availability of ventilators with enough oxygen supplies. Now, When it came to delivery of medical services, for the first time, we shifted our focus from surgical care to medical care by merging specialties and developing critical and non-critical groups in every category of healthcare workers. Few major hospitals were designated as COVID and non-COVID. Coming to the technical aspects, efforts were made to enhance PCR lab testing facilities all across the country. Telemedicine facilities were introduced in outpatient department. We are also striving to introduce novel therapies. Our information centers are functioning 24/7 for uninterrupted data flow management at crisis management cells. Timely establishment of quarantine facilities, isolation centers, financial allocations, and early implementation of non-pharmaceutical interventions were our focus from the very start. Policies being issued are in line with national SOPs and guidelines and best available international evidence and are being updated as per evolving situation. Besides, all this indigenous production of PPEs is also underway. We are also utilizing networking, and regular teleconferences are held with stakeholders to take them on board. Our technical working group has also been attached with the National Command and Operations Center dealing with COVID. The challenges being faced by medical corps are no different than those of the world, and they include overwhelming of healthcare system and segregation of COVID patients in non-COVID hospitals, and contact tracing and testing. Then protection of healthcare workers is another major challenge. Then infection control and lack of adherence to non-pharmaceutical interventions, especially in our part of the world where strict lockdown is inevitable. Evolving situation in itself is an unpredictable factor to follow. So, as we see it, capacity building, sharing of experiences, and evidence is the way forward. Research at this stage is premature, so we need to take an evidence-based, innovative approach. The military medical forces all over the globe are actively engaged in helping their nations fight against the COVID-19 pandemic. One of Winston Churchill's quotes from his first book, The Story of Malacan Field, says, and I quote, "The spectacle of a doctor in action among soldiers in equal danger with equal courage, saving lives where all others are taking them, allaying fear where all others are causing it, is one which must always seem glorious, whether to God or man." Unquote. There are a few efforts on our part, and we continue to seek guidance from the world, especially countries hit at the outset with a pandemic, and learn from their experiences. I would conclude by saying that despite daunting challenges, the Army Medical Corps is committed to provide patient-centered, safe and quality healthcare to Pakistan Armed Forces personnel, their families and dependent population. I would also like to express my sentiments about our Turkish brethren, Kardeşim. These sentiments that Pakistanis have for the people of Turkey have their roots in history. Qaid-e-Azam Muhammad Ali Jinnah, father of our nation, at the time of appointment of His Excellency Mr. Yahya Kemal Beyatli as first Turkish ambassador in Pakistan on March 4, 1948, stated, and I quote, "Turkey has drawn our admiration for the valor of Turkish people and the way in which your statesmen and the leaders have struggled and fought almost single-handed in the midst of Europe for your freedom and sovereignty, which is worth mentioning. Muslims of Pakistan will entertain sentiments of affection and esteem for your countries. Unquote. Ladies and gentlemen, Pakistanis enjoy the gracious attitude of Turks towards Pakistanis and are often termed as Kardesh, which means brother. Let me assure you that the sentiment of warmth and respect will always be reciprocated. Long live the Pak-Turk Brotherhood. I pray that you all and your families and fellow countrymen remain safe and blessed always. I thank you all.
We really appreciate your kind words, and thank you very much for this nice, useful presentation. And we also have a chance to listen your very important experience, Mr. Major General Mohammed Salman Ashraf, Deputy Surgeon General, Pakistan Army. And thank you very much again for your kind words. And another very important country in Asia, and also Turkey has a very special relations, like Pakistan and Bangladesh is also very important country, and we see as another brother country in Asia, not far from Turkey. Professor Major General Fashnur Rahman is together with us. He is Director General Medical Services, Bangladesh Army. Sir, welcome again. Can you hear me now?
Yes, sir. You are quite audible. Thank you very much indeed.
So I would like to ask some questions. I think you don't have a presentation at the moment, but I would like to ask a question, some questions if you are ready.
Yes, sir, please. You can put forward, and also, yes, I can present a bit. We're a bit ready. We can also present.
Okay, sir. What is the general, I would like to ask a general question about the COVID-19 epidemic. What is the general situation about COVID-19 pandemic in your country, in Bangladesh? Can you please give some general information?
Yes, sir. Can I tell in the moment, or I can give you the idea while in my presentation? Can I proceed to my presentation?
Of course.
Okay, in that case, let us enjoy the presentation now.
Of course.
Excellencies, ladies and gentlemen, I am Major General Mohammad Bashir Rahman, Director General Medical Services, Bangladesh Armed Forces. I'd like to welcome you to my presentation, and at the same time, I'd like to thank for the gracious presence of today's Major General Dr. Muhammad Sadiq Akar, Major General Muhammad Salman Ashraf, today's Hakan Salik, and all present in this August session. It is indeed today's session is the session of friendship between countries, Bangladesh, Turkey, and Pakistan. You know, due to the presence of COVID, a very microscopic organism that could unite the whole world to a particular aspect, that all are united for the cause of the humanity, for the cause of the respective nation. So I thank Pakistan. We had been with the Pakistan, but after our liberation war back in 1971, our father of the nation, I remember he Bangabandhu Sheikh Mujibur Rahman, and Turkey, really friend of Bangladesh, your father of the nation. When personally I was in my primary education, then we studied on Kamal Atatürk, a great man. So, ladies and gentlemen, it is the sequence. I'll try to cover a bit word scenario, comparative study, Bangladesh scenario, steps taken by our government and also from our side, and then we'll go for conclusion. If we see the world picture, is a everyday cases. Almost you are seeing it, and also the death toll also you are seeing. Next. So it is the whole world, affected with this corona. And for the Bangladesh, it is spread all over our country. And death-wise, say it is up to yesterday, 14,658 was affected. And it is the total cases. Total cases is 71,000. And it is the death figure, but 925, but yesterday it was 42. If we see about the distribution of the affected cases, you see, younger ages are more affected. At the age of 20 to 40. And among the disease, it is the elder age is the more affected. If we go for the sex variation, it is the male partner more affected, but they are more exposed. That could be the reason. Next. And if we compare the affected cases, still today you see Bangladesh is the lower one is the Bangladesh. It's a gradually increasing, and red one is the USA. So comparing with these countries, still we are increasing very gradually, having some movement, migration of our people from urban to rural and rural to urban due to government leave given on the crisis of the COVID-19. They decentralized from capital to periphery and from periphery to again to capital. During this last Ramadan and the Eid festival, again we had a big migration from urban to rural and rural to urban. And within this period, we had 4 migration of the people. Each after each migration, there was a bit rise of affected and death. And we are expecting that since we have just enjoyed the Eid, maybe this month of June and with half of July, we are expecting there might have a sharp rise of the affected and dead. But since we experienced only the 3 migration before, there was a very gradual rise. We are expecting this month we will have gradual rise. Next. So you see the recovery and death. So far we are recovered. It is 40,000, and death is 973. Next. Now, our overall, the measures we have taken from our government side, overall, and for our armed forces, we want to have a, the flattening of the curve. We want to have a gradual rise up to the peak and gradual fall. Until today, the way we are advancing and seeing the disease progress, I believe that our graph will be gradual rise and gradual fall. Next. Say, when these countries had the 70,000, affected cases, China attained 70,000 on 48 days. USA attained this on 68 days. India on 104 days. Italy on 56 days. Bangladesh on 94 days. 9 June. That means it started. We can assume, seeing this trouble, that when we attain, say, 110 days, what could be our speculation? Next. Bangladesh is not new to handle disasters or different crises. As you heard from the general of Pakistan, in 2008, they really were grateful to Pakistan. They helped during our disaster in 2008. Our country is fighting long-standing battle against this impact of climate change. And currently, in our southeast part of Bangladesh, there is our influx of refugee from Myanmar, and there is the largest refugee camp we are looking after. That is also, it's a big burden for our country. Next, we are handling the COVID-19. It's a entire world body is handling it. I will tell you. So, in this issue, all public, military, private sectors have come together, and we're working together to fight this coronavirus. Next. Our government, headed by our respected Prime Minister, Sheikh Hasina, were working under his guidance. Say, we have evacuated on 31st January last year almost 312 from Bangladeshi from Wuhan city. And it is the first step to dealing with the corona affairs. And we had to quarantine them for 14 days. And successfully we could, there was no corona positive cases. On 15th March, again, 142 returning came from Italy. And yes, in this team, there were some, corona positive cases. Ultimately, what you are seeing now, the upward trend, maybe the focus was this. Next. On 22 January, we had a screening of the travelers from China. Next 2nd February, ultimately we had to suspend, the on-arrival visas. We had to, control the seaports and land ports. We had to establish screening devices on different entry points. Next. On 17 March, we had to close all the educational institutions. Government has to declare compulsory holiday. Almost 2 months, limiting public transport. And armed forces deployed, maintaining the social distancing, still we are maintaining it all over the country. Next. You know, in our country, the PCR lab was not that much. One was in our Armed Forces Institute of Pathology, one in the Armed Forces, and another was in the Institute of Epidemiology, Disease and Research. Now, government has established 52 PCR lab in the health sectors and 11 PCR lab in our armed forces in different combined military hospitals. As I mentioned already, we got total positive cases 71,000 all over the country, having the death toll 975. Next. We have extended our treatment facilities, even establishing the intensive care unit, provisioning ventilators. What we had to increase much more at both government and private hospitals. You know, the giving treatment to both COVID and non-COVID patients. Adequate medicines we had to mobilize, but medicines will come to the slide next. That's the medicine used in different countries. We had to, make it available here. Next. We had to go for awareness campaigns till it is continuing all over the countries. Telemedicine provisioning. The provisioning of sufficient PPE for health workers and those are frontliners, even to our armed forces, those who are deployed for the social distancing, Army, Navy, Air Force, Police, Border Guard, Bangladesh, etc. Next. And the government has to distribute, ensuring food to different areas and the people, because since it was under lockdown, nobody was allowed to go even to the shop. For that, government has to distribute all this. And it was a very successful campaign. Next. In Bangladesh Armed Forces, our affected cases, how much? 3,000. In armed forces, 3,000 cases, but death is only 32. Most of the cases retired. So we are expecting that in this way, I think we can go much advanced. In case of the prevention and promotion, we have to go for disinfecting different points, roads, markets, mosques, unit, training barrack, etc. We have to install thermal scanner, thermal gun for screening at different points. Empowering combined military hospitals, healthcare provider on different training aspects. Next. One operation, this is contact tracing, it is acted very nicely in our country, in armed forces. By ensuring this contact tracing, we could successfully block the chain of communication. Of course, by limiting our office hours and limiting the attendance every day. We are working every day. We are doing our office every day, but we have limited it. Next, about the investigation and treatment facilities, as you know, provisioning of the trials, establishing the fever clinic, successfully manning the isolation center and establishing the isolation center in different parts of the country as well as in the armed forces. Separation of corona wards, in different areas or particularly in hospitals divided into corona part and non-corona part. Provisioning medications. We have to make available remdesivir, oseltamivir, hydroxychloroquine, ivermectin, then injection tocilizumab, favipiravir. So our patients are getting all these medicines, and really up to we are getting very successful. Next. The drugs, it is shown, hydroxychloroquine, doxycycline, ivermectin, favipiravir, oseltamivir, tablet zinc, ascorbic acid, antibiotics like meropenem, moxifloxacin. And one important aspect is come up, that is the continuous supply of the oxygen, maintain the oxygen concentration. And we are ensuring it, our intention not to send the patient up to the ventilator. We don't want to put the patient to the ventilator. We want to give the patient, ensuring the high flow, maximum high flow oxygen therapy through the cannula or the catheter. And it is working very nicely. Next. If we see the sequence of events in our country, 30th January, first meeting with our military leaders, we sat together on 30th January. On 2nd February, our Honorable Minister of Health, State Ministers, Cabinet Secretary, and other, it was a very successful meeting, and we got guideline from this meeting. On 2nd February, we established Corona Control Cell. On 15th February, we successfully released from the Corona Quarantine Center. On 15 March, the expatriates from the Italy. Next. This was the event, I already mentioned some. On 26th March, there was nationwide lockdown. 9th April, formation of contact tracing and monitoring committee. As I mentioned before, contact tracing team acted really very successfully. We sent 2 teams on our friendship relation to Kuwait and Maldives. Next. Next. We had BTC, with the China. So we got the experience of Chinese medical team who really worked directly with the corona patients. And it was so successful. We got ideas from them. And we are grateful really to the government of China. Of course, we are undertaking some research study on the drug, on the different, the phenomenon of the corona diseases, observational study, and etc. Next. Pictorial, you can see we have put some disinfection chamber. We have to disinfect the vehicles. Hand washing is very important. We have set hand washing point on different parts of the country. Initial screen by seeing the temperature, disinfection tray, then this sample collection point we have opened separate, by establishing the rubble. We have established this collection point. Next. This is the clinical screening we are doing. This is from the fever clinic. Next. This is the sample collection point. We are collecting the sample under sun due to obvious reason. And PCR laboratory. Next. with the PPE. It is our inside the corona world. Next. And evacuation from different parts of the country, we are utilizing helicopter also. Next. Send evacuation, Next. This is the ICU and the instruments. We are many. Next. Corona ICU. Next. The happy moments. The persons were really going back to their home after having suffered from corona. It's so enjoyable. It's a very happy moment. They are also encouraged joining their kith and kin and family. Next. Ensuring the adequate supply. We are using the helicopter, distributing medicine and equipment to different areas. Next. Of course, there are future challenges also we are thinking, maybe the vaccine, maybe the resuming to the normal life. Of course, the health economy is a concern of the whole world. And also the post-corona, some unlawfulness may happen that we also look for. That's the thing. And thank you very much indeed.
Sir, thank you very much indeed. You almost answered all of my questions, and we also have a chance to see the capabilities and the abilities of Bangladesh as a country and Bangladeshi army. It is very nice to listen and watch your presentation. It was very detailed and very informative presentation. Thank you very much again. I really appreciate. After Islamabad, Pakistan, Dhaka, Bangladesh, and we go to now Cyprus in a university in Republic of Northern Cyprus, Girne, Kyrenia University, American University. Mr. Assistant Professor Sadık Akyar is together with us. He is a director of the International School of Diplomacy and Security Research Center in Girne American University. So, Professor Akyar, if you are ready, we are listening to listen. We are listening.
Yes. Thank you very much. Thank you very much, Mr. Hakan. Now I am sharing my presentation slide. Okay.
Yes, please.
Now you see?
Yes, now we see you, your presentation.
Yeah, okay. First, I'm happy to attend this with, as your distinguished anchorman, the most popular anchorman of Turkey, and distinguished general from Pakistan and Bangladesh Army, and also with the distinguished audience. I salute all of them with whom my respect. And here's my agenda today. We will discuss the general military health system and the field mobile health system, SCBM system in COVID-19 pandemic, and role of military in COVID-19, and the challenge and change in security policy as conclusion. This is, first of all, I would like to mention the general classification of military health system. The run in the echelon, you know that this is an echelon has been used by Navy forces. The role first aid station, we can say in the role 2 or echelon 2, limited with bed and operation capacity like infirmary. Role 3, facilities where many surgery and tests are performed, starting from 30 beds and more than 150 beds. And especially NATO and role 3 level for the health and treatment of those participate to the operation under the deployable task force command. It's important for NATO forces, role 3. But what about role 4? Mr. Hakan, yesterday, during the first webinar session, Madam Brenda Butterfield is the vice president of Zoll company. She mentioned two Vessel Hospital belongs to United States Army. The one of them, as far as I know, Comfort Anchor in New York. The second one, Mercy Anchor in Los Angeles. This hospital and during in the pandemic, construction of field hospital having more than 1,000 beds change the understanding on for status, because up now we classify role 4 as military is a fixed, stable, constant facilities located in a specific region, but up to now, the armed forces or the government try to assess role for facilities. This is an important change amendment with the Corona-19 present us. And another classification maybe is the categories, in according to production style. So it fixed, prefabricated, the field system, field mobile health system, field tents, mobile container or vehicle, and mixed system where all these are used. But semi-fixed prefabricated system sometimes use them. For example, Turkey now construct 2 Saharan for pandemics, but it's a fixed system. It's constructed with a fixed system. But Chinese and North Korea, beginning of coronaviruses, they construct prefabricated hospital, but end of coronaviruses, and then deconstruct. CBRN decontamination system also start mentioned with field and mobile health system. Yeah, some example starting from role 1 and field hospitals, and they are CBRN decontamination system, personal protective equipment, especially in the isolation units, isolation tents. They are important for pandemics. Yeah, this is an important part of our today agenda. What is the role of military? The military support and the government agency and especially national health service with 2 subjects. This one, support with equipment and system on hand armed forces to national in the use of national health service. For example, field military hospital set up in Central Park, New York, in Hyde Park, London. Again, in the armed forces, as general, they mentioned this issue also, support military health service staff. Some countries declare partial mobilization to support national health service. Another important issue, the armed forces support with military troops. This is they use this method. They have been used almost whole country in Europe, including Russia, China, and United States. But there is an important difference. The other one, especially in Italy, first time Russia helped assist in Italian government and Italian armed forces in a NATO territory. It is important. And also, as we realized during government also use organization and supply chain capacity competence of armed forces during this pandemic. Yeah, what is the relationships in the health system and security policy in the future? What the armed forces could evolve its doctrine, policy, and organization. First of all, armed forces will transform its organization, training, doctrine, and policy, and we are hearing that some countries started to do that. the NATO and EU also will develop new policy and strategy for pandemic situation and environment. And these two important institutions, the Western country, is Turkey also a member of the NATO, were criticized during pandemic. NATO supported member country, especially with logistic transportation perspective. The active body of NATO, we say that SPA, the logistic agency located, organize all transportation, helping or coming membership country. But EU was criticized, they continue to criticize the response of during pandemic and post-pandemic. And PESCO, permanent structure defense cooperation amongst EU countries, also criticized and need to develop. And new cooperation and collaboration will be established in the context of pandemic, and we mentioned Russia and Italy, is that Turkey also, is that Turkey also, the help some country that all is a existing historical problem. If we give an example, for example, Armenia, mainly in the pandemic could be start near cooperation, collaboration, and understanding between armed forces. For example, pandemic could increase smart defense exam. Conclusion: what we learned from pandemic COVID-19, we understood that health system with all dynamics start appear as a new security dilemma. Armed forces will review its organization and competence to be ready to increase situational awareness against pandemic. Field and mobile health system will be main tool during next pandemic and used with fixed system, and they continue be used both military and national health due to being cheap, flexible, and portable. And CBRN system also has been accepted as a part of regular health system. The last one, Mr. Hakan, this is always I argue this subject almost all platform which I attend, and newspaper article, whatever. As honestly as an academician and as a person interested in this issue, honestly, the main reason of COVID-19, the government also now they don't know, and if you don't know the reason, you can develop some measure, you can develop take some measure. For that reason, I rely on this issue that the under the United Nations umbrella, it doesn't matter for me, or independent investigation committee should be established, and COVID pandemic must be investigated, and the reason must be clarified. There are many about that, but we don't know this claim. And as personally, as academician, as the former military person, I accept to learn the main reason of COVID-19. This is kind of my presentation. You know that this motto we use in Vietnam War, leave no one behind, and nowadays continue to be used with troops, National Health Service staff, and the company or institution related with health service. Thank you very much, your patience.
So thank you very much, Professor Sadık Akyar, for this detailed and very informative presentation. Also, thank you very much for your comments about me.
Thank you very much.
My profession.
Well, I say
I really appreciate. And generals, doctors, and Professor Sadık Akyar, I really appreciate your precious time and very informative and nice presentation. So we have a clear idea what's happening in Pakistan and Bangladesh, two very important countries.
Mr. Hakan.
Yes, please.
May I say something about what Army did, because we have in the two ally country colleagues. It could be in the useful for. May I say something about what the competence of Turkish Army and the lesson learned of Turkish Armed Forces from pandemic? It's so important in my understanding, my point of view. The first, Turkish Armed Forces protecting its troops and staff from coronavirus. So important. You know that U.S. And France aircraft carrier come back mainland and or closest Navy bases because infected coronavirus. Other important issues is the Turkish Armed Forces continue to its operations. Syria, Iraq, East Mediterranean, NATO operation, United Nations operation, and military outside military base. The most important issue is that Turkey created Libya operations. Now the result impact on all the world. For example, 2 days ago, Turkey also daily Turkish Armed Forces continue the routine. 2 days ago in Pakistan, Karachi port, the joint venture project with Pakistan and government, the Milgem main body iron ceremony held. This is an important issue. And for the second on the side, especially our ally and our ally country, they can benefit from Turkish Armed Forces this pandemic. First of all, training. People taking the trainings in Turkey outside officially and also accredited Turkish government company and institution, and could joint exercise. The other important issues is that Turkey also continue with any interruption without any cutting its military assistance. Like for that reason, advice, especially in Pakistan, we have in the
Mr. Sadık, thank you very much for this important additional information. We have a technical.
I understand.
Thank you. I really appreciate it. I think your internet also have some difficulties. We have some difficulties to hear you, to understand you, but in general, we have an idea what you are saying. Thank you very much indeed again. And thank you for Pakistani Army and Bangladeshi Army, our brothers and distinguished, esteemed generals and doctors. And have a great day, have a good afternoon, and thank you very much again. My kind regards.
Very much. Sit Pakistan and Bangladesh. Zindabad Pakistan and Bangladesh.
Thank you very much. Thank you very much. Stay safe. Stay safe.
Ladies and gentlemen, we have a break now, and we will come back to finalize our military medical web exhibition. GMT at 11 a.m. and Turkish local time, we will come back here at 2 p.m. So we all wait you here again to finalize our medical web exhibition. See you at 2 p.m. at Turkish local time. Bye.